Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today we're talking to our class 1015 on our second part of Introduction to PCS Coding, focusing on Section 0, Medical and Surgical Coding. Our key points today will be looking at each of the characters identified with specifics to medical and surgical coding from characters 1 through 7. And our biggest focus will be on root operations and body parts specific to this category. To start, just a quick refresher. We want to remember that there's 7 characters identified within PCS coding. For a little bit more detail on that, make sure you look at the last video just as a refresher to look at details on the structure, organization of your PCS codebook, how to identify a code within a table, and just a little bit of overall information on guidelines. If you have other questions that you want to send to me, feel free to at my email or by text at my number listed above. So let's get started. Now, the first thing to keep in mind is when we know what our first character is, our section, we always know the first character of your code. And so that's going to be 0 for anything that is surgical or medical related, or specific, not related. There is separate areas for medical and surgical related that are not surgical procedures. So it's important to identify those differences, and also keep in mind there's a couple of unique categories such as obstetrics that even though they may be surgical procedures, they're done for obstetric patients and should be coded in a separate section other than the regular medical and surgical section. Also, keep in mind that your body systems are going to be rather different than what you may have learned in anatomy classes up to this point. So if you look in your textbook at page 978, you'll see a list of all of the different body systems identified according to PCS coding. It's important to look at these because page 976, it's important to look at these because characters 0 through Y, including from 0 through 9, and B through Y, excluding a couple, will identify the different body systems that you're familiar with, but also some of them are broken down into more specific areas. For example, many of you are probably familiar with the musculoskeletal section and many of the parts that it includes. For PCS coding though, they've separated that from muscles to tendons, the bursa and ligaments, and then to head and facial bones, upper and lower bones separated, upper and lower joints separated. So you have a total of 4, 5, 6, 7, 8 different body systems according to PCS coding that identify that one body system many of you have become familiar with. So for those reasons, make sure that you always pay attention to the sections that you're in. You'll also notice that there's different areas for anatomical regions to the general anatomical area, as well as upper or lower extremities. And so these would apply when something is not specific to one of the other body systems. It's important to memorize these or at least have a really good idea of what's in there, although keep in mind, you'll always have your PCS codebook available when you're coding, or you'll have access to a coding system such as an encoder like 3M. The next area that we want to talk about is going to be your root operation. And we're actually going to look at that in a little more detail here in a moment. But remember that root operations identify the type and purpose of the procedure. And for that reason, I've characterized them here for you into a couple of different groups that many of your study systems and many of the different tools that you'll find available tend to also categorize our root operations for surgical coding. We'll get to these in just a moment. But we want to keep in mind that root operations, there's about 30 to 33 different ones for medical and surgical coding. And that can seem like a lot, but it's something that when we group them and start to identify them in more detail, you'll become rather familiar with. For our fourth character, we're going to be looking at our body part specifically within the body system. So we've already said different body systems based off of the areas, but now we're going to look specifically at what body part within that. And this is another thing we'll be taking some time to look at today, and some of the appendices that are available to you for this identification. Our characters 5 through 7 identify different information such as approach, device, and qualifier. And not all of these for device and qualifier will always apply. You will remember that when a character does not apply, the placeholder Z is going to be listed instead of an actual character to identify that there's nothing there. For an example of a qualifier, you may have a procedure that is done either as a diagnostic or therapeutic purpose. And if it's done diagnostically, you'll put an X for diagnostic. But if it's not done diagnostically, or if it's a procedure that can't be done for diagnosing, then you'll have the character Z to identify that there is no qualifier and no other options are available. So let's come back now to root operations. I have in front of me a couple of my PCS code books. One of them is the Optum 360 2018 edition Expert, which was available last year for some coders that were using in this system. I like the Optum books because they tend to have a little bit of different focus, but I also like the AAPC books, and it tends to be a preference of the coder themselves as to which particular book they like. For this class, we've recommended the 2019 ICD-10-PCS Expert Edition from the publisher AAPC. The reason for this is there's a lot of different details that are great for students out of the AAPC codebook that you may not find in other options. I like that part for learning, but I also like the Optum one when I'm in the field. In the Optum one, they have an Appendix C that wasn't found in the AAPC. But you can find this information anywhere online if you do a simple YouTube search, or if you look for different categories you can put the root operations for medical and surgical coding into. In this one, it's a comparison of medical and surgical root operations by grouping them together based off of the type of root operation they are. In your textbook, you'll see that it's organized alphabetically, which makes a lot of sense. In fact, in your textbook, it's very important that you look at the differences between root operations and the examples that are given. For our purpose, though, let's talk about the different groups that you can make flashcards to identify the different types of root operations. These are all, again, for Section 0, medical and surgical. So let's look at this. The first one we have are root operations for procedures that take out some or all of a body part. When we talk about taking out a body part, we want to remember that we're not taking out something that shouldn't be there, such as a foreign object, and we're not talking about something that grew there that's not part of the body, such as a mass. We're talking specifically about body tissue, either an organ or part of an organ or part of the skin. In this case, we have different codes that are available depending on the type of procedure. And the ones that are listed are destruction, detachment, excision, extraction, and resection. Now, you may be familiar with some of these terms, especially the most commonly thought of, which is excision or detachment when we talk about medical and surgical procedures. And in fact, this particular group for root operations is one of the most popular. Now, one thing that I will say when you're looking at these is be aware your provider may use different terminology than what the PCS codebook is looking for. For this reason, it's important for you as a coder to dissect the op note to find information about what is it that's being done, how did we do it, did we take out all or some of the body, did we replace it with anything, did we use a device? These are all questions that when you're trying to determine the proper group and root operation that you have identified. Make sure you look at some of the videos this week. We have one that's really good on how to dissect an op note and what you're looking for that applies these exact same concepts. The next group that we have are procedures that put in, put back, or move some or all of a body part. And that's this one here, putting in body parts. These include things such as reattachment as opposed to detachment, repositioning, transferring, and transplantation. And you may think of, when we talk about transplantation, you're probably thinking of, say, a heart transplant or a kidney transplant, and that would be 100% correct. But we also had things such as a skin transfer, where part of the body has been moved or transferred to another location, repositioning, where we're putting something back to where it's supposed to be, and reattaching any kind of lost limbs. Our next one are procedures that take out or eliminate solid matter, fluids, and gases. And these ones are pretty straightforward. We have root operations for drainage, which either takes out or lets out fluids and gases. We have root operations for extirpation, which either takes out or cuts out any kind of solid mass. And so this will be very similar to your first couple of root operations for taking out body parts, but the difference is, what are we taking out? We're not removing a body part, we're removing a solid matter. And then the last one is fragmentation, which is where we break some sort of solid matter into pieces in order for it to be able to move out on its own or with an additional procedure. For our procedures that involve examination of body parts and regions, or exam only, this has two different categories. You have inspection, such as a diagnostic cystoscopy, where a provider goes in to look and see if they can find any kind of blockage or problems that may be occurring symptoms that the patient has. And we have mapping, which can be done such as a cardiac map, where they go in and they're looking at specific conditions and mechanisms within the brain or the heart. After exam, we have procedures that alter the diameter or root of a tubular body part. And so when we think about tubular body parts, you want to think about all the parts within the body that have a tube. If you're thinking about arteries and veins, you would be on the right path. But also keep in mind various different areas, such as your ureters, as well as the urethra, as well as fallopian tubes or eustachian tubes. Anything that has a tubular body part is going to be found to have very specific root operations within this group and should not be coded with root operations in other areas. These ones include bypass, dilation, occlusion, and restriction. Also, keep in mind that anytime you have these four these four root operations, they're only going to apply to tubular body parts. And for that reason, if you have a procedure that might be considered a bypass but is not done to a tubular body part, you'll want to relook at the type of procedure that you're doing to see if something such as repositioning might be a better option. The next one is very similar to procedures that apply to tubular body parts, but instead are procedures that involve devices. And these always involve devices and should only be done when involving a device. Procedures that always involve a device include change, insertion, removal, replacement, revision, and supplement. And the difference you want to make sure you identify when we change a device, this is exchanging a device without cutting or puncturing the patient's skin. So they already have a device that's in, and we're either taking it out and putting a new one in, or we might be revising it, correcting a malfunction. When we insert the device or remove the device, those ones are going to be identified as either insertion or removal. But then we also have replacement, and a lot of times coders get this confused with the root operation for change. Now, when we talk about root operations that involve a device and we change a device, that's only changing the device itself. When we talk about replacement, we're actually not replacing the device, but rather the body part that the device is taking place of. So, anytime you see the term replacement, you want to remember that that's not the same as replacing a device, but rather replacing the body part. Revision and supplement. Supplement is basically keeping the body part but giving it a little boost of information, and then revision being to go in and fix something that was wrong with the device itself. Our last three, we have procedures that involve cutting or separation only, other repairs, and other defined objectives. For cutting and separation only, we have two root operations, division or release. This is basically where we have something either dividing a body part, where we cut it and have two separate pieces, or we're releasing something that's being obstructed by a body part. And so let's say that we have a carpal tunnel here, and this is the medial nerve that's being pressurized, and we might go in and release that pressure by cutting a ligament or something around it, some tissue, and in that case, that would be a release, not a separation, even though the procedure may be something similar. Other repairs include controlling of blood and repairing, such as repairing of the skin. And then other procedures include alteration, creation, and fusion. Alteration meaning that we're altering what was there, such as a facelift. Creation being that we're creating something that was not there, such as a sex change. And fusion being completely in a different area, such as for a spinal fusion for releasing of pain. So those are some of our root operations. The other parts that we want to pay attention to, and we mentioned already, we have approach, device, and qualifier. And we have a little example here of our patient, which you may remember and find familiar from last week when we talked about the differences in approaches of a patient for the different types of procedure. We identify the type of procedure with the root operation. We identify that it's a surgical procedure. We've identified what body system it's in. But the approach itself is telling us how did we get there when we got to that specific body area or body part. And in your PCS code book, on the recommended version of the 2019 PCS Expert Edition from AAPC, page 53 has an approach table that lists all of the different approaches. However, you'll also find this in your textbook this week, as well as available to you through 3M. In your textbook, your approaches are on page 989 and continue on through 992. And these examples in here give some great details about the differences between approaching from the skin or the external approach, which basically says that anything done to the skin that does not go through all three layers of the skin. So even if we are cutting into the skin, and you may consider that percutaneous, if it doesn't go through all three layers of the skin or open, if it doesn't go through all three layers of the skin, then it's going to still be considered external when you look at that approach. You of course have procedures that are done to the natural opening or orifice. You have procedures that are done percutaneous, such as an incision into the chest, percutaneous endoscopic, such as a laparoscopy procedure, open, which are what most people think when they think of surgery, and endoscopic via natural openings. So when you're looking at all of these, and also percutaneous endoscopic, and keep that in mind that you may go in endoscopically and decide to cut into another area based off of the need of the patient. So the last thing to keep in mind is, or to look at when we're going backwards here, is the body part itself. And in the back of your PCS book, as well as on 3M, you'll find that PCS has an appendix that identifies the specific different body parts keys. And this is going to be body part key appendix B in our current PCS code book. For appendix B, what they do is they take the anatomical term, not necessarily the layman's definition, and they identify where that anatomical term will fall within. Now keep in mind, sometimes you may have a layman's term, sometimes you may have the anatomical term, and sometimes the PCS term is more of a layman's term than the anatomical term. And so for those reasons, it's important to identify exactly what part of the body are we looking at. In the front of this code book, and in many of your PCS textbooks, you'll find anatomical pictures with labels and illustrations telling you exactly what are the anatomical names and where are each of the different parts located. In your 3M that you have available in this class, you also have appendices that allow you to have anatomical illustrations and plates that you should check out in your references under 3M when you go in and you look at reference options. For now, when we look at appendices, and we look at Appendix B, or under your reference table in the integrated ICD-10-PCS, under your Help tab, you'll find the references. Don't worry if you can't remember all of that. We have all that instruction in an assignment that is assigned this module. The Appendix B is one that's very helpful to us because we can go in here and look at the body parts terms to identify if we have something very specific. Let's talk for a second and let's say that we have the difference between the epidermis and the dermis. If you remember, both of these are identified as skin, but they're different layers of the skin. You have the top layer and you have the second layer of the skin. And with CPT coding, it's especially important in identifying certain procedures that may or may not include different levels of complexity. For PCS coding, this is actually the opposite issue. We can look up dermis and find that the dermis is considered according to the ICD-10-PCS value as skin. I can also look up the epidermis and I can see that this is identified as the ICD-10-PCS value also as skin. And so in this case, it uses our layman's term for the anatomical definition. However, if I go in here and I'm talking about a lobectomy, where we're removing a part of the lungs, I'll notice that the body part for the lobe is going to be identified as separate areas. So when you're looking at an excision for part of the lungs and you're determining if an entire lobe was removed, you'll actually find that that is considered an entire body part, not a partial. And so for this reason, it's important to look at the body parts key when you're identifying the different root operations between resection and excision, because some of those will identify all or some of a body part. Well, that's all that we have for today. Make sure that you do some of the exercises and look at the differences between PCS coding for medical and surgical section on root operations and specific body parts. We have a couple of really fun activities for you this week with our discussion and assignment that I hope you'll enjoy. Until next week, where we'll be talking about bringing it all together and some of the different considerations we have to have with reimbursement. Have a great week.